Good afternoon, everyone. Good afternoon, all of you who can see and hear us for this closing panel of Forum Health Innovation, FIS 20. This year, it has been fully online with over 12,000 participants throughout 3 days. And I have the honor, the pleasure, and the happiness to say that I am here welcoming 4 key celebrities. I have here a team of personalities. They represent the best in terms of citizenship and the reason why we are here today. In this closing panel, we decided to gather some key speakers to discuss education, health, economy, and the role of citizens. I have a friend, Betty Breyer, and she said, when my son was born, when her son was born, I said, what do you expect of him? And she said, I would like my son to be a full citizen, a mindful citizen. So I would like to convey this idea of what it means being a full, mindful citizen to journalist Fernando Gabeira, former minister, also Mandetta, our dear friend Mônica de Bolle, and immortal from the Brazilian Academy of Letras, Rosiska Oliveira. It's a pleasure to have you here for the closing panel of FIS 20. I would like to start by asking Fernando Gabeira to talk a little bit about his perception of citizenship and the correlation between citizenship, health, education. What can you tell to Bet, my friend? What can she expect of her son once he grows old? Good afternoon, first of all. Thank you for the invitation. Good afternoon to fellow participants of this panel, people I respect and I personally like. I don't have one perfect answer to this topic. When I was asked to speak about a citizen and health, the first reaction I had was, well, I don't have a ready answer to all citizens. I just have my experience, the experience that I share to your attention. I worked with healthcare when I ran for different positions and different seats in Rio de Janeiro. I ran for mayor and also for city representative. I've always thought that health was a right of citizen, and we needed transparency to know that. At that time, my work was to go to a hospital and show people how hospitals worked in Rio. I did that many years ago. But this willingness of enhanced transparency, of course, respecting patients' privacy, this willingness of transparency is something absolutely essential to society. Till today, I think that this is something that continues to exist, but it's still hidden. In Rio, Mayor Trivela created a group of guardians whose main purpose was to avoid transparency to be shared with the public. The group prevented TV channels and journalists and reporters to address what was happening at the different hospitals. So the first thing that has always attracted my attention in citizenship and health is to really show transparency so that everyone would know how the money is being spent and what kind of role and service is given to the person. A second aspect which I like is solidarity. This week I had an interview with Margaret Atwood about what we've learned from the pandemic. And we've agreed on the fact that many positive aspects have resulted from the crisis. Probably the best aspect is that the society, the government, and the private initiative have realized that everyone is on the same page. We are all involved in a process in which we need to cooperate with each other. This has been probably one of the most important aspects. Yes, different campaigns, one encouraged by you, and I joined your campaign of finding hotel accommodation for physicians and for staff so that they wouldn't really put at risk their own families, to campaigns that were run by different areas of the city. For example, some of the slums created their own crisis committees. And I had visited a place named Paraisópolis, which is also a low-income population area. And I learned from that moment that they had also managed to create a cooperative effort during the pandemic, something which was really important. So the community hired some additional physicians. They defined where people would go into social isolation, how people would be fed since they had to be in-house and could not go out. So solidarity has taken place in different levels, and this is something absolutely essential. It's not only your health which is at stake. You have to understand there is a broader process at stake, and we need to be part of it. You please let me know if I should stop talking. I've always been thinking about the public sector and the private sector. I worked with this aspect during the dengue fever crisis. At that time, I tried to obtain a cooperation and an articulation between the beds of private hospitals and the beds in public hospitals. And at the time, I faced a number of difficulties when I brought together the Association of Hospitals and tried to talk to them. I was interested in solving the problem, and I was told that whenever they had any experience with the public authorities, they had always been disappointed. No agreements had ever been respected. The promises of the public authorities had not been delivered, and they were scared, and they were not very willing to restore these kind of relationship, because they were afraid of not having their expectations met. And this is one of the points which I think is equally essential. We should not only have cooperation in the society, making everyone participate, but also try to have a cooperation between public and private entities, private initiative at large, so that there can be an articulation in moment of crisis responding to immediate needs. These are the issues that I have addressed as a citizen. I am a middle-class citizen. I have my own private healthcare plan, which is very different from someone who has to go to public hospital and face difficulties. But regardless, I think these are the priorities. As a citizen, I think we should always think about the working conditions of people providing care in healthcare centers. This is also something essential, in my opinion. Everything is part of a process in which we go beyond your personal interest and start understanding the whole scenario. Just to close my thoughts, I'm not a specialist, but I am always concerned about health because I think we have to meet everyone's needs. And I've been observing throughout the years that healthcare problems are getting more and more complex. When I started seeing the first breast cancer cases, there were very few oncological surgeries. Now, a breast cancer would be immediately followed by a reconstructive surgery. Up to my adult years, I have never heard of a gastric bypass surgery. So needs have given rise to different procedures, more and more demands, more and more need for procedures. And we really have to define very clearly what our priorities are. And I've always thought that if we work in interaction with other sectors, I've already realized there was a gap, especially when I was a politician and being a citizen as well. So especially the fact that we don't have public sanitation available to 100% of the population. In my opinion, this is one of the most serious problems in Brazil, a problem that we haven't been able to effectively tackle. But now there is a new legislation framework with a possibility of addressing that. In my personal experience, and I travel a lot around Brazil, and I understand the situation of other people in smaller cities, I think having good public sanitary conditions would be really a great solution to many of your problems, because there are many problems caused by this lack of appropriate sanitation. In many places where there is access to public utilities and sanitation, people have get sick less frequently, and then work performance and school performance is better. I think that if we could work together as citizens, as Brazilians, and as professionals, if we could work together, I think sanitation, public sanitation would be what would unite us all. I hope that before I die, I would like to see Brazil at least partially covered by full public sanitation systems.
So you're always present in all major national debates. I'm really proud to have you here in Rio, close to us. But you are from Brazil, you are from Minas, you're Brazilian, you're all over the world, and you live fully in full citizenship. Minister Mandetta, first of all, I would like to thank you very much for the generosity of your time to be here with us. I know that you're a very busy man. And Gabeira started talking about this issue of sanitation and social inequalities and the deep asymmetry that he has witnessed in his travels all over Brazil. First of all, I would like to thank you as a Brazilian for your work as a Minister of Health. You were an exemplary minister. You worked without stop, trying in every way possible to provide your contribution to this terrible pandemic that we are living. Number two, your experience as a politician, as a minister, that must have been more intense in getting to know the deep Brazil in depth, the furthest away regions, indigenous populations, where access, as Gabeira said. So one thing is for us to be citizens living in noble neighborhoods in the city of Rio de Janeiro. And some people live in very difficult situations, sometimes in the same city, like here in Rio de Janeiro, or in other places very far away from us. Minister, I would like you to tell us a little bit, how do you see this wide array of different citizens we have in Brazil, and how can health contribute for them to be included as better quality citizens? Today we have very different levels of citizens, first class, second class, third class. How can we provide equal access to citizenship? Maybe what Gabeira said would be a first step for our challenge. If this regulatory mark of basic sanitation, if it is effectively fulfilled, maybe the first step for citizenship is treated water and sewage that is appropriately managed or processed. This is a great step. What do you think, Minister Luiz Henrique Mandetta? And thank you very much for your presence here today. Thank you, Josier, for the invitation, for the entire organization of our conference. And I would like to greet Gabeira, my reference with all your history and everything that you can teach, and Monica, now my colleague, now she is studying medicine. Well, I have been a doctor for a long time. You have a great work and your vision, especially considering the role of women within the concept of society and health. The first question that you asked for, Gabeira, I thought was a question for everyone, this issue of plenitude. And as you say, it depends very much where you are. So in Rio, I remember a song, I just want to be happy and walk peacefully in a favela where I was born. If we think of the man from my region, and then it is to observe the landscape and see the river flowing seamlessly. So there's a man in an eternal fight or struggle against death, and all society built their models. Our country used to have a model from 1500 until 1988 to provide care to those who could afford, and those who could not afford would receive care due to mercy. That's where we had the holy houses of mercy. So it was philanthropy, and this model went out in an epidemic of meningitis in 1974 during the military rule, and it was don't show the numbers and never reveal the severity of the disease so that we can go through this. The disease, when you get it has a basic instinct of humans, which is preservation of life, and no one can hold that. There is no censorship in the planet to hide that. And when human beings fall ill, and in our social format of Indians, black, white, rapidly, the Indian chiefs raised the warning that are teas and everything, and we rapidly had the first epidemic of the 21st century that is announced online through the internet. And there is a 30-year-old child called SUS. It was a challenge. It wasn't born ready. And once it's questioned by its concept of fullness, it is related, and it's a challenge to our generations to provide health through the state with the efforts of the state as a duty of the state and a right of the people in its tripod of integrality, universality, and equity. When the two concepts, integrality and universality, so the fast translation, it's everything for everybody, meaning it's going to be universal and whole. And our SUS has not yet written what do they mean when they say integral. How far can you go in the possibilities of your state to put it in place? And equity, to treat differently, to attain equality, and then maybe reach the plenitude or fullness of services. No one, or the completeness of services, no one wants to discuss the policies of equity so that we attain completeness. So our system is partly covered by the government and partly private, and then people need to invest with their own funds to buy appointments, drugs, and everything, or those who are sometimes in the very long lines in SUS, a summation of public and private expenditure, the total money spent in healthcare is already something that is very high, and there's a high level of expenditure. So as Gabeira says, one of the pillars of what he said is the lack of transparency, the lack of planning, and then this comes way back from health promotion policies of awareness building of citizens, going through the community agents that needs to be revitalized, prevention programs for infrastructure work such as basic sanitation, which is unacceptable that are almost 100 million Brazilians without basic sanitation. Rio de Janeiro still has an area of social exclusions that are romanticized, and well, they think it's try to make it glamorous. They glamorize it. They love to live there. No, they don't. There's just no way out. There's no sanitation, not even the right to go and come and try to be happy. So in our concept of system, we are still building the first third of the first cycle of life. The life cycle of a healthcare system is 100 years. So the first Brazilian that was born under the SUS was born in 1988. Now our system is 32 years old. It's still going to become an adult, and then it's going to become an elderly, and the life expectancy. We have many good things. The country had more inequalities in health, and we have reduced. Maternal mortality was absurd, so very high. People were toothless, no oral health, a complete lack, and sometimes death due to because people didn't have access to care. And we built a wall called SUS. And during the epidemic, part of the society that didn't know it or pretended that they didn't know it or only got to know it through the crisis in emergency systems, people realized that that policy is a policy that needs to be raised to the level as a first discussion, a priority. If we look at the level, the discussions for the municipal elections that we are having now, the main thing in the agenda, in the places where people live, where they are, the only thing concrete is the city. The state is virtual, the country is virtual, but their neighborhood, their streets, the municipal healthcare system will be the main item that they are paying attention at. There are many and many elections. It's not because the population doesn't say that they want to have a healthcare system and it is a priority. But it's the exact measure that an important part of Brazilian elites, and then I would include economists, that end up looking and seeing, well, if I had this money and help to do other things. And then we start a discussion in the National Congress, political representation, and a policy for the industry. I know some things I read, Monica, about the payment for damages that I read, and how much we paid on this epidemic because we completely deindustrialized our national health complex. We are so fragile in terms of sovereignty, even to manufacture masks with a competition with the Asian countries. I see education as an umbilical link. For every year of study, I reduce 1 year in child mortality in our country, which is still too high. The populations of places that are far away, such as the Amazon, and faraway places such as the outskirts of large cities, because they are very violent. No doctor wants to work there. Bringing medicine and nursing, that doesn't go by itself. The culture needs to go there, theater, the concept of full citizenship needs to go to these places. This is a challenge that we are dealing with, and our attempts last year were all in that direction of primary care. So there were doctors in Brazil. This was approved by the Congress, and they paid much more for those who go to faraway regions in Brazil, and then asking for results. All of this permeated right now by a complete disappearance or blackout in the Ministry of Health, similar to the blackout of science that we had a while ago in Fiocruz. And now today we have the military intervention and emptiness of thought and action, and we are perplexed to know that it was canceled because the computer was not working, because they didn't get the information, and for this reason the research was canceled. There was a huge crisis. The president celebrated the fact and was celebrating the difficulties in science, and the next day he says, well, now the computer is on and I got the piece of paper, so you can resume the research. This is what undermines and affects and makes us, is really outrageous for the society. So we want to build a system of full citizenship so that your friend's son may reach completeness and fullness in the exercise of citizenship. We can talk about specificities of the SUS, but I think that the life cycle, and Gabeira is right, and I would place a full-time education as something very important for us, and together with these two pillars to get away from the very precarious situation that we are now. Very good, Minister Mandetta. Thank you very much. We're going through very sad times in Brazil, and this is very sad.
Gabeira has been writing wonderful pieces about that, revealing the concern of the Brazilian society with the moments we've all been through. We really have to find a way of peace, prosperity, trusting science, respecting diversity. Brazil has to resume its normal way of being. We have to come up with a way of doing it. You know it, Mr. Mandetta. Today, in fact, we've been discussing for 3 days a virtual congress, very successful, discussing governance, management, regulation, clinical models, funding, entrepreneurship, innovation, education, industrial development of healthcare, and research. Many countries have participated and shared their experiences, sharing with Brazilians, so that we can really rethink the Brazilian healthcare system as much as possible. And there is something which is common to all discussions: financial resources. And that's why I would like to hand it over to Mônica de Bolle. So thinking about citizenship, but at the same time, we always have two sides of it. Economy as opposed to health. Nobody talks about economy and health, economy and education. Things have to go hand in hand. I have the impression that nobody builds anything with people, right? People such as Gabeira and Mandetta mentioned are the most important assets of a nation. So we cannot prioritize the economy and lose in health or lose in education or not making cultural investments that would transform the son of my friend into someone which is less full and realized. So, Monica, it's great to have you here. You are taking a beautiful international career, author of bestseller books, and you have contributed very smartly, teasing and really adding a lot to the discussion about healthcare. And you translate complex things into something that is very understandable. Welcome, Monica de Bolle. Thank you very much for accepting the invitation to be here with us. Now you have the floor. Thank you very much for the invitation to be here. It is a pleasure and an honor to be here with Gabeira, whom I constantly read, Rosiska, and good afternoon to you, Minister Mandetta. So I will start by answering your question in a different way, because Gabeira was to the point about public sanitation. I was surprised about Minister Mandetta without mentioning COVID and pandemic and how it got to Brazil, how it got disseminated, and how it's coming into its second wave. We have to get the elephant in the room and really think about it, because after all, it does have implications. It has had reverse implications, and certainly it's going to have more impact to economy, considering what's going on in Brazil right now. So hospitals are getting quite full again. And I'm speaking from the U.S., where we have 200,000 new cases every day. And that's been the case in the past 24 hours. So I think we have a very important topic here. First of all, there is no economy without people. Economy is a human construction, and as such, there is no economy without people. And therefore, health prevails over everything. It is obvious, isn't it? But for many people, it's still not as obvious as we would expect, especially for some members of the current government. When the pandemic hit Brazil, we had some time to get prepared, because the pandemic started in December in China and just got to Brazil in the beginning of March. So we we had heard about it 2.5 months before. There was no clear recognition by some parts of the government about the severity of the pandemic. At the same time, and here I would like to hear Minister Mandetta say something about that, because the measures implemented were not enough, even though we had seen what's going on in other countries, and the consequences were the ones that we know for the population at large and for the economy. At that time, as we can see now, but in a much lower size, because now, or magnitude, because we know that social distancing measures are necessary. We have to wear a mask. Everything that is done to try to avoid dissemination of virus, and new lockdowns that are done are still lockdowns, even though somewhat in smaller magnitude than the first ones. But they all have a long-term impact. But at the same time, there is a mid-level consequence to economy, which is much better, considering the experience of Asian countries, for example. So science and economy to us, considering the problem that we still face and problem with which we are going to still have in 2021 as one unique problem that is going to remain in Brazil because we failed in providing the first responses that we should have given to the pandemic when it got to Brazil. We haven't had a contact tracing policy, and we could have done it in March and April. I really wonder whether it hadn't been done. For many people, there is SUS today, the universal healthcare system, it has gained much more visibility to the Brazilian society, but it's still underfunded. There hadn't been a distribution of required resources. The Ministry of Health first received resources to distribute to states and different cities of the country. The resources were kept for a while and released only later. It was not enough. The government didn't release enough to the SUS. And now we are about to start facing the second wave. So in the question you've just asked me, Josier, about how funding gets into the equation, this is quite simple. Funding should have been directed to health. Ministry of Health should have distributed resources appropriately, considering that there is an uneven distribution in Brazil, as Gabeira pointed out in his comments. Someone who really knows all the heterogeneity of Brazilian society and how we have inequalities in our countries. There was no strategic plan to deal with the dissemination of the disease in the country. Many people suffered unnecessarily because of that. States, especially in the Amazon region, suffered much more than could have, and now they are going to the second wave. So you see, it all has a history behind it. And it all goes back to the first responses of the government. And I'm not the only one questioning about that, because from an economic perspective, from a humanitarian perspective and public health perspective, unless there is a strategic plan, unless there is an appropriate way of dealing with a pandemic like that, right from its inception, it gets out of control, and the effects on the society, on the citizen, on people proportionally affected is huge. And this is exactly what we are observing now, a communitary crisis of huge proportions.
I know that Gabeira needs to go because he has work to do. If Gabeira, if you would like to say goodbye by saying something, please feel free. Thank you very much. Unfortunately, I have been called, and really, I think that the issue of education has been put, sanitation, and those are essential elements for us to find a way. But as you said, about the abnormal situation Brazil is going through, I think all of this will go through a solution. This going back to normality, this exorcism of the major nightmare we are living, will only solve as Americans solve theirs. So we have this situation to solve because, and it's very clear that we are being under the government of a madman. He's insane. He was celebrating the death of someone who was in a scientific experiment. He celebrated the defeat of a vaccine, a man that even threatens the United States with a war. Gunpowder, he said, we're going to get our gunpowder. Like one country would be invited by the other. But this won't happen, of course. And I am publishing an article on the internet that Brazil spends much more with the retirees of the army than with gunpowder. It's 26 billion with retirees, with staff and retirees, and 4 million with equipment. So, in fact, what he threatened yesterday, the United States, of the nightmare of going back to the beginning of World War II. So, therefore, I think that there is always a political way out, and without the political way out, all our good ideas will be frozen. Thank you very much for your attention and the possibility of participation of all these people that I really like and respect. Now I have to go to work. Thank you very much. Thank you, Gabeira. Good work. Thank you very much for your kindness of coming. It's an honor to have you here. Monica, I don't know whether you had finished. Can I move on to Rosiska, or would you like to say something to finish what you were saying? No. Let's listen to Rosiska, please. I will have to leave soon too. I told them that I will have to leave. Yes, sure. But we are going to continue here if you want to answer the questions that Monica asked, or any other final comment. It would be great. And then we move to our dear Rosiska, and then we continue until the end with the two ladies ruling our stage. So, Minister Mandetta, please, your closing remarks, please. And maybe you can respond to Monica de Bolle. I just want to make it clear that I'll leave it recording by my team, because I want to hear Rosiska and her vision of the entire social geopolitical imbroglio and everything that is going on. Monica, it's very difficult for us to look outside the global context of the epidemic. First of all, there is China in the WHO in January announcing a disease and saying that it started in Wuhan in China. They were going to isolate Wuhan, blocked all flights, and if you isolated people, we could contain the disease, giving the information that it was just a virus. Only when virus got to the West, to Italy, that we saw the collapse of healthcare systems in Italy, France, Germany, and the United States then. Brazil is no different from any other country. We're not an island. The disease causes tension in healthcare systems. In the beginning, when I was in office, we did not have enough PPI, no goggles, no masks, no foot protections. If you remember in England, working with garbage bags, working in the hospital, you see that there was a lack of global moderation because China shut down their exports, and they concentrate the majority of those supplies. So the capillarity of basic care by basic energies is very obvious, and it's part of the health planning for this profile of disease. But you cannot send someone to the war without the appropriate weapons or protection. You need to dress them, train them. So the expansion of care and the number of ICU beds, and in 45 days, no other country did that, instituted so many ICU beds. In the Amazon, because of their decision, they believed in a theory that it was so warm there that the virus would not get there, would not multiply. And the businessmen in the region of Manaus kept their companies open, and it went through the working class. If you go to Manaus, you see that there is a belt around the city of labor class, differently from São Paulo, that it went for that the disease started at higher classes, so we had time to build a structure to avoid the death due to lack of care. It's a history, it's a learning. I think that everyone learned, but the SUS, in terms of giving a chance for people to fight for life, they were able to, a lot of difficulty, attain their objective. In terms of using their full potential, they could not do that because the context of that moment. And Fiocruz, who has just received an award, we had an airplane in Beijing airport with 150 ventilators in the airplane paid by Fiocruz when the American private initiative went there, gave the money back to Fiocruz, paid the fine for Brazil, didn't take the ventilators from the airplane and just changed the flight plan. Instead of coming to Brazil, it went to the US. There are some masks that were supposed to go to one country, went to another country. It was very cruel. We really missed having a conflict mediation organization in the global healthcare market, using much more defense and military strategies than a health-based strategy. The debate is already taking place. This week we had a very hard debate with Harvard people about the use of health information, national sovereignty, and what to do so that healthcare systems all over the world are induced to understand an atypical warning, and it was an emergency just for Wuhan, but it's international warning. And this is how the report from China and the WHO was published in January and February. And only in March did we see that the virus was very competent in terms of transmission. And us adopting New Zealand and Nordic countries as a parameter, when we have a favela, we record TB, and very narrow alleyways, people living from the rest of the cities with informal jobs, is very different. We will need to create different strategies for our inequalities, and these social abysses can be minimally addressed in terms of health so that the economy grows back again and thrives again. I apologize because I need to say that I have a 3-hour drive now. I need to be there at 7:30, and I had told you I thought we were going to be earlier, and because I am 1 hour earlier than you, but still I need to go from Campo Grande, from Botoquena, Paradise, in Botoquena Mountains, and we are going to talk about environment and health. And I don't know whether Brazil is worst in health or environment, or we're in the use of gunpowder for our protection ambitions. So I apologize for not staying any longer. This is a very important debate. I leave you with Rosiska and Monica. Thank you very much. Thank you. Thank you, Minister Mandetta. Have a nice trip. Thank you. In a beautiful Pantanal. See you soon. It's been an honor to have you here. Well, now we are finally going to receive this distinguished Brazilian, this extraordinary woman.
Someone we all enjoy a lot in Brazil. Someone who is really an honor in Brazil because of her intelligence, knowledge, and her look to see the world. So, Rosiska, based on what you've heard from our 3 panelists, could you please sum up citizenship and how people can really regain their self-esteem? How can we contribute? How can we really make sure that access to health can really be something concrete, so that everyone can have access to information, to the appropriate information? one of the main problems that we've heard from Monica has been the lack of centralized communication. We had the federal government saying something, and cities saying something else, states saying a third thing, and people were really lost. They did not know what to do. They did not know whether they should wear a mask or not, whether they should go out or not. So being part of the Brazilian Academy of Letters, please tell us, what is your opinion about citizenship in this world we are currently living in? Thank you very much, Professor Rosiska Dárcy de Oliveira. Good evening, Josier. Thank you for the invitation to be part of this very intriguing seminar. Good evening, Monica. It's great to be here with you. I had planned to say something else, but I'm going to accept your question because I was highly interested in a character that has been absent from our conversations, in my opinion at least, which is a citizen, not as a victim, not someone who doesn't have access to all the things. And we've heard everything that is not given to citizens. But I am still missing citizens as a key player. Most of the solutions for this tragedy that we are facing are in the hands of these people. We are dealing with a very dark shadow that has been glooming over the world, and we cannot do it when there is no vaccine, when there is no specific medication, without involving citizens, without seeing the behavior of citizens. How do citizens behave before that, when it's everything on them, whether they have good hand washing, wear a facial mask, avoid meetings? How can we make citizens really take a center role? Considering the conditions we all face, I would say the population has been doing quite okay. What we've faced, very few countries have faced. The President of Brazil disseminated, rather than clear messages, he developed messages which were exactly against what had been shared with physicians and scientists. Someone who behaved differently from everything that was recommended to the population. In other words, the head of the country, who should be our role model of behavior, sent all the wrong and opposite messages. So the leadership, or a negative leadership after all, which was and still has been someone who mistake the population, just makes our population behaves very erratically. The population does not know really what is the behavior to be followed. Right now, even though we have access to medical care, we also need prevention. We need the epidemic to be controlled, not to be disseminated as in Europe. There is a second wave in Europe causing a chaos. Countries such as France and Switzerland, very rich countries with well-developed, top-quality health systems with packed hospitals. They are exporting patients to Germany. But why? Because there as well, the message was not striking enough, even though it hadn't been misleading and almost criminal, illegal, as it had been the case here. The Brazilian population has been subject of a crime. I'm sorry, Minister has left, because I would like to thank him for the time we were happy and we did not know, for the time when we had someone to guide us. We no longer have that. In view of that, the Brazilian population has had a behavior that can be commended, as Gabeira showed us. So even the populations which have fewer resources, that live in low-income communities, they have got together, they got organized, they are surviving as if there were no government in place. This is a time in which prevention is absolutely essential. Since 1978, last century, since Alma-Ata conference in Kazakhstan, organized by WHO, we know that health is not a problem that affects only physicians and patients. It is, and health was defined in Alma-Ata so many years ago as physical, mental, and social well-being. Therefore, back then, it was introduced the idea that prevention was absolutely essential for health. And once this element was brought to the equation, there was the essentially equal idea that citizens are the key to maintaining health in a society. But what are we doing in our country to prevent things? What are the instruments that we have put in place? We've heard here school, and I have envily recalled an experience that I had planned to tell you, which was the most successful experience of WHO when they decided they were going to start preventing smoking, working on prevention of smoking. So what did they do? They gathered a set of strategies, but starting from kids within schools. And children learned not only that they should avoid smoking, but that they should start also asking their parents not to smoke. They learned that it was bad to their health. The fact that their parents were smoking was bad to the health of children. And children learned that. They learned the lesson. They learned they had a responsibility as citizens in view of a problem. You see, what a great example, what a great lesson these children had. They learned about how harmful it was to their health, and they learned how to be citizens. Whenever we ask what we are made of, who we are, What is a citizen? We have never asked that ourselves. Our schools never approached that. My point is, subjects can do something for themselves. Subjects, people, can just have social distancing. They can follow good eating habits. They can exercise, things that many people do. But this is not being a good citizen. A good citizen is a different thing. And if I may ask, I'm going to read an excerpt. I don't want to go into too many details, but at the same time, I don't want to forget naming people. A citizen, is a person, is someone who is exercising solidarity in this very tragic moment we are all facing. Citizens are all of those, and with that I pay homage to them, to physicians, to healthcare professionals who act not only as professionals in hospitals, public and private hospitals, but also as citizens who are working hard to save the countries. Those that, in addition to going to hospitals every single day, they are in the media saying a number of true things, just putting an end to fake news. And I pay my tribute to all these people, just naming one person, Margaret Nelpo. Citizens are also the researchers who are fighting science against ignorance, those who work in lab and are there running tests, all those that help with what they have, let's say a basic staple or food or thousands of dollars to really help hospitals and sponsor vaccine. We are all being citizens when we say something. Gabeira is not here. Too bad, because I would like to tell him this is a way of exercising citizenship, such as it's mine, when we write and speak to other citizens, defending science, really demystifying lies. I also pay tribute to the network of citizens who take medicine and food and drinking water to communities. Those who keep on wondering, how can we improve the health? How can we innovate? All of us today, and those who can hear us from their homes, from their offices. What is the main challenge of our history? We haven't been prepared to be here. And there we are in our challenge. Our role as citizens is to fight and to contribute, to fight against this virus. Using the resources we have at hand. All of those who have died, who are being made fun by a president saying everyone will die, carrying on his back over 170,000 dead people in this country. And this is what we all are carrying as a very heavy burden. On behalf of all of those who passed, of all of those who survived, and all of those who can still have a chance to survive. Let's do it with the resources we have at hand. Let's keep on fighting, and we are going to succeed. We are going to put an end to this nightmare because we are many, many citizens. Some have not given much, fine, but we are all citizens. And with the little that we have given and may give, we are fighting. And we are going to succeed. We are going to be the winners because we are many, because we have exceptional talents, we have very well trained people, we have fantastic research centers, we have marvelous devoted physicians, and because we have this weird way of having faith in life. Thank you.
Thank you very much, Rosiska. You really touched us with your words that were so sincere and so full of love and solidarity and respect to citizenship. I thank you ever so much for being here with us. And now I would like to give the words to Monica de Bolle for her final comments and to say goodbye so that I may also conclude our meeting today. It's been an honor, Professor Rosiska, to have you with us. You are always an inspiration and you are really brilliant as a citizen. Thank you very much for having offered such deep knowledge and such a sensitive analysis of the role of citizenship in our country. Please, Monica, feel free to make your final comments so that we can close this spectacular meeting of FIS 2020, already preparing for FIS 2021 in November next year. Until then, we are going to have many preparation meetings for our upcoming FIS. Thank you, Josier. I was very proud to listen to Rosiska, and the feelings that she gave voice to are exactly mine. And she said something fundamental when she started talking. She said that citizens and leaders and citizens as leading people, protagonists, and this dark ages we are going through in Brazil and here in the US too. And as a demonstration of what is possible, and we are going to win and we are going to walk out from this. Citizen leadership right now has two things, two fronts. Number one is to recognize the risks each person is exposed to and how citizens should protect themselves and others, especially others, those that they do not know, not just their family or their relatives and but the people that they don't even know and might get in contact with them, and they might be infected, and their behavior is not appropriate to the huge risk that we are living, especially in Brazil, considering that we have started a second wave of the pandemic. There has never been such a important time for citizen leadership to be emphasized. It's important for people to wear masks, to have social distancing, not to crowd. It's important that they are not in under-ventilated spaces. They should pay more attention to preventive health. It's important that they pay attention to conditions. And today there's another epidemic that we are having in Brazil obesity, hypertension, cardiovascular diseases, cancer. They're all preconditions for severe COVID disease. So this leadership of citizens in terms of looking after their own health and looking after others' health, the collective health, such a difficult time, it is so important and it's very relevant and important. And the second point of protagonism of citizens is as important. We should never forget of our role, our political role, and how things can be changed. Here in the U.S., we have just gone through historical elections in the middle of a pandemic, and now the pandemic is going through in a third wave very strongly, and here in reality, the data are much worse than they are in Europe, much, way, way, way worse, because likewise, as the Brazilian president has avoided his responsibilities with regard to the population and protecting the population, the same thing has happened here in the United States. And there, the epidemic was never controlled and is still not controlled. Well, the answer has been given by of citizens in their right to vote, their right to exercise citizenship through the vote, taking out a president that did not protect their health, did not protect finance, did not protect the integrity of all these citizens right now. So, we are now at the end of 2020. We are going to have presidential election in 2022. Before that, we are going to have city elections next weekend. This is the time for citizens, Brazilian citizens, to exercise and to be protagonists now, starting next weekend in favor of health, in favor of education, environment, science, in favor of everything. And all the conditions that are very important for citizenship and equality. And this is how we transform things. And things can be transformed. I think that when we look at the dark years that we had and the light that we are starting to see, and the dawn of the new administration, of course, there will be some problems, but this is not the point. Just going from absolute anormality to some normalcy is very good for us. It's a good feeling. And it's important for citizens to exercise protagonism. And I would like to say that in a different way, yes, we can have a chance. We have full capacity of getting back into the right path, in a path of normalcy. As we could see in every way, that he is absolutely incompetent, and I don't want to use any other words to qualify. And this protagonism should start to be exercised next weekend, and even before that, with social distancing and looking after the collective and thinking about that, and no one is a citizen without thinking of others.
Thank you so much, Monica, for your closing remarks. I think we will be capable of answering my friend's bet about her child's future from your comments. The word that can sum up everything we've said, bet, for your son to be a citizen, he needs empathy. He needs to put himself in someone else's shoes. And to close our event, I would like to pay tribute to everyone. Urban cleaning, our policemen, our security staff, waste collector, drivers, deliveries, those that deliver food and drugs, everyone who is out there and who have put themselves in our shoes. We couldn't leave home, so they've been providing huge services to all of us. all the healthcare professionals who have put their lives at risk. As a physician, I feel very honored to say thank you to all healthcare professionals for having faced things without forgetting that we are all a collective of service providers. Being a citizen, for me, is having empathy, is always putting myself in someone else's shoes and trying to understand the needs of the person as if it were to ourselves. I would just like to stand up and give a big hand to all of you. I think it was a wonderful afternoon. Thank you very much. See you all in 2021. Thank you, Rodrigo, Manuela, Bruno, Flavia, Vasconcelos, Renata, all the team that put together our meeting, all the production which did a wonderful work. Everyone who has been with us today, I would like to thank deep from my heart. Thank you very much for putting together this very great meeting. Monica, Rosiska, stay safe, stay well. Thank you all very much. Thank you.